Lots of people believe science is neutral, that evidence speaks for itself and policy simply follows the facts. But if that were true, why do the most profitable drugs get approved fastest, whilst others are buried for decades? This video breaks down how funding, pharma and fear shape what we call truth and what gets left out. So if science is supposed to be objective, who exactly is it working for? Drugs and Addiction, an Anarchist Perspective, Dickie Dredd. This is part 42 of the video series. We're still on chapter 5, Science, Scale and Lies. Section 43, the manufacture of ignorance, funding, pharma and fear. The myth of scientific neutrality unravels the moment we follow the money. Behind almost every major study on drugs, psychiatry or behaviour lies a web of funding, patents and quiet suppression. What passes for evidence-based policy often served shareholders more than citizens. Marcia Angel exposed how modern medicine was captured by its own industry, research designed, financed and published by pharmaceutical giants who profit from chronic pain management, not genuine cure. Drug research operates through what Anarchist and Conway call the manufacture of doubt, the deliberate creation of uncertainty to delay reform. When independent studies threaten profit, counter-reports appear almost overnight, funded by think tanks or health foundations, whose names sound neutral but trace back to the same handful of corporations. The pattern is identical to climate denial and tobacco science. Seed confusion, question motives, repeat the mantra of more research needed. Every delay means another quarter's profit. Ben Goldacre's Bad Pharma, in 2012 film, laid out the machinery in forensic detail. Negative results vanished into drawers. Ghostwriters polished the rest into publishable proof. Academics trade integrity for consultancy fees. Journals depend on advertising revenue from the same companies they were meant to scrutinise. What emerges is not science but public relations with graphs. Substances that could heal, psychedelics, cannabis, MDMA, are sidelined for decades, whilst patented tranquilizers and painkillers flood the market under the banner of safety. The revolving door completes the loop. Government advisors drift effortlessly to corporate boards and back again, translating regulation into profit strategy. Ministers cite expert evidence, produced by committees chaired by future directors of GlaxoSmithKline. Result is a cartel of credibility. Policy, framed as protection. Profit, disguised as concern. When David Nutt was dismissed for ranking alcohol as more harmful than ecstasy, it was not because he was wrong, but because his honesty threatened an economy built on sedation. The same architecture of denial governs every crisis. Anarchist and Conway showed how the lobbyists who once defended tobacco moved on to deny climate change, perfecting the psychology of confusion. Pharmaceutical monopolies simply adapted the playbook, publish selective data, amplify uncertainty, then sell certainty in a bottle. Angel warned that medicine's credibility collapsed the moment its research became proprietary. Universities who once pursued knowledge now compete for sponsorship. Laboratories become patent incubators. The language of discovery has been replaced by the grammar of investment. Psychedelic research now risks the same capture. Corporations rush to patent psilocybin analogues while ignoring the cultures that preserve them. What was once sacred is monetized, stripped of context, and sold back to those it was taken from. As I note in Practical Anarchy, healing divorced from community becomes just another commodity. Fear remains the key currency. Without it, neither the drug war nor the medical industry could function. Fear keeps the public compliant, the patient obedient, the politician electable. Each new epidemic, opioids, vaping, spice, justifies more surveillance, more prescriptions, more management. As Goldacre observes, the real epidemic is not addiction, but opacity. We are drugged not only by substances, but by statistics, data sculpted to calm investors, not heal the sick. What dies first is in this arrangement is curiosity. True science begins with what if. Captured science begins with we already know. Funding determines belief. Belief secures funding, and the circle closes. Federbund warned that science is not sacrosanct. It is one tradition among many. An anarchist science would make its data open source, its errors public, its loyalties transparent. Until then, every laboratory built on fear will keep producing the same drug: obedience. So the issue was never just bad science. It's a system where funding shapes truth and truth protects profit, which opens what we call evidence, which means what we call evidence may tell us less about reality and more about power. So if the data itself can be shaped, how do we decide what to trust? In the next video we look at what happens when healing itself becomes a commodity and who gets left behind when it does. So next up, still in chapter 5, Science, Scale and Lies, we move on to section 44, Psychedelic Science and the Return of Meaning.